Hello all, today we will discuss about dyspnea. Dyspnea is an unpleasant awareness of one's own breathing. It's a sign as well as symptom. Factors responsible for dyspnea: pulmonary capillary congestion, ventilation perfusion abnormality, chest wall abnormality, neuromuscular disease, defective oxygen carrying capacity of blood. Pulmonary capillary congestion occurs in left ventricular failure. Interstitial and alveolar edema occurs in LVF. Ventilation perfusion abnormality as in COPD, interstitial lung disease, ARDS, etc. Chest wall abnormality as in kyphoscoliosis. Obesity is an important cause of dyspnea. Neuromuscular disease, GBS, myasthenia, OP poisoning, muscular dystrophy all can cause dyspnea. Defective oxygen carrying capacity of blood as in anemia is an important cause of dyspnea. Clinical detection of dyspnea is by tachypnea, respiratory rate more than 22 per minute, and use of axillary muscles of respiration. Exertional dyspnea occurs in left heart disease, pulmonary disease. Exercise causes increase in venous return, and that causes increased blood flow to lung, and that causes pulmonary capillary congestion around alveoli, and that causes the decreased lung complaints, that causes the exertional dyspnea. Next, NYHA grading of exertional dyspnea, New York Heart Association grading. There are 4 classes: class 1, class 2, class 3 and class 4. Class 1, there is no limitations. That is, ordinary physical activity does not cause undue fatigue, dyspnea or palpitations. Class 2, slight limitation of physical activity, that is, ordinary physical activity results in symptoms. Class 3, marked limitation of physical activity, that is, less than ordinary physical activity leads to symptoms. Class 4, unable to carry on any physical activity without discomfort, symptoms at rest. Next, orthopnea. Orthopnea is dyspnea on lying flat. It's relieved by sitting up or elevation of head. It occurs in left heart failure, acute asthma, COPD, diaphragmatic paralysis. Mechanisms of orthopnea: first, on lying flat, there will be increase in venous return to pulmonary vasculature that causes increased pulmonary congestion, that causes decreased lung complaints. Next cause, mechanical cause, diaphragmatic movement due to viscera on lying flat. Next, part of lying below the level of heart is more on lying flat, that causes dyspnea, that causes the orthopnea. Next, paroxysmal nocturnal dyspnea. It occurs in decompensation of left heart. Attacks of dyspnea which occur at night and awaken the patient from sleep, and usually occurs after 2 to 5 hours of sleep, and takes about 10 to 30 minutes for recovery. Mechanisms of PND: all factors of orthopnea come into play. Extracellular fluid shift to intravascular compartment due to decreased vascular tone, that causes increased venous return and vascular volume expansion. And compensatory sympathetic overactivity in failing heart is less during night, and that could predispose to PND. Pulmonary capillary pressure increase, and that can cause dyspnea. Next, trypopnea. Trypopnea is dyspnea in left or right lateral decubitus position, occurs in heart disease. Platypnea. Platypnea is dyspnea in upright position, occurs in left atrial thrombus, left atrial tumors like myxomas, pulmonary arteriovenous fistula. Pulmonary arteriovenous fistula example in hepatopulmonary syndrome. Thank you.